Welcome to the training for healthcare professionals. Let's begin with the module on linen and laundry care at hospital. Before we begin, let's look at the key learning objectives. After completing this module, you will be able to understand what is linen and laundry care, handle, store and transport linen, maintain linen and laundry to prevent the spread of infection. So what does linen and laundry care include? Linen and laundry care involves providing clean linen and removal of contaminated linen. Click on each image for more information. Clean linen. This includes any linen that has not been used since it was last cleaned. Soil linen. Includes used linen contaminated by blood or any other body fluid, and linen that has been used by a patient with a known infection, whether soiled or not. Linen care is provided every day while cleaning the patient room, before a patient occupies a bed or room, after a patient vacates a bed or room, and also each time a linen item is worn or used by a healthcare professional. Linen care is important, as soil linen is a source of large numbers of pathogenic microorganisms. Using clean linen helps to minimize infection-related mortalities. Moreover, linen care is essential for basic patient comfort and care. Identify which of the following items are needed for linen care. Drag and drop the correct items in the box below and click Submit. Now let's look at the linen care procedure. If a facility treats all used linen as potentially contaminated, no additional separation or labeling of linen is needed. If standard precautions for contaminated linen are not followed, then some identification with labels or color coding as per your hospital policy is required. Also note that you should place soil linen in a double bag if the outside of the first bag is visibly contaminated or wet. Place wet contaminated laundry in leak-proof bags that are either color-coded or labeled at usage site. Handling and transportation of linen and laundry. Wash hands before handling clean linen. Handle contaminated laundry directly, as little as possible. Use of PPE, personal protective equipment, is must. Do not sort or rinse laundry at the location where it was used. Place and transport contaminated laundry in red bags or containers labeled with the biohazard symbol or according to your hospital policy. Avoid holding contaminated laundry bags close to the body or squeezing them while transporting to avoid punctures. Now let's learn about linen processing. Click each image for information on linen processing. Temperature of 140 degrees Fahrenheit should ideally be used to process linen. However, each hospital may have their own regulations on what temperatures to use. Any linen that is repaired or mended needs to be rewashed. Laundry floors should be cleaned regularly using a disinfectant. Hand hygiene should be performed after handling any used linen and prior to handling clean linen. Shelves used to store clean linen should be free of dust and pests. No cross-contamination should occur between clean and soil linen. Loose soil linen should not be placed on floors or chairs. Complete all documentation as per hospital policy. For example, linen collection date, treatment type, and return date. Uniforms and clothes of clinical staff must be changed daily. They should be washed at home on the hottest wash appropriate for material. Check hospital guidelines for dress code policy. If a uniform becomes contaminated with blood or body fluid, it must be changed with a clean one as soon as possible. Regularly clean washing machines and tumble dryers. Iron clothes to remove any residual microorganisms. Points to remember. Discard mattresses if fluids have penetrated into the mattress fabric. Every linen item must be cleansed and disinfected with a germicidal detergent. Wash all linen in hot water. Soiled items should not be left for more than 24 hours before laundering. No eating, drinking or smoking should be done in the laundry area. Regarding incident reporting, any incidents where linen is not managed safely and appropriately should be reported. For example, when sharp items have been found in linen or where clean linen is found to be dirty. Now let us see a demonstration on care of soiled linen. Note that the equipment, material and procedures used here could be different from those in your hospital setup. Understand the technique and then apply it in the context of your healthcare facility.
Clean linen must be used for every patient. You can do a clean for dirty laundry swap at the hospital. This way you can avoid carrying soiled laundry in the ambulance. However, if you do have to bring used linen back to the station, it must be put into a white laundry bag with the top tied for transportation. Any laundry contaminated with body fluid that has to be taken back to station, for instance after a home birth or a trauma that's been airlifted, must be carried in a red alginate bag. These bags have a seam that dissolves so they'll split in the washing machine, releasing the clothing. However, this design does mean that the bags have a weakness, so they must also be placed into a white laundry bag to stop the contents spilling out during the journey. Then, when you arrive at the station, put this double-bagged linen into the contaminated laundry bin. When removing dirty laundry from a stretcher, don't be a blanket hugger. Put on a clean pair of gloves. Roll up the used linen. Hold it away from you, and then put it in the soiled laundry bin. Clinical waste must be removed from every ambulance at the end of every shift, regardless of where it's going next. Each bag must be sealed with a plastic tie and a label filled in with the station name, date and vehicle identification. Don't fill the bags to the max. 3/4 full is the limit, so that they can be securely sealed. At every ambulance station there's at least one large yellow clinical waste bin, with a lin bin attached to the wall, containing labels, spare bags, ties, and the key to the large bin. The bag can then go into the large bin. With sharps boxes, you also need to follow the same procedure regarding the labels. And they also must be placed into the same large clinical waste bin when they're 3/4 full. Food items and general waste must not go into the clinical waste stream. If you ignore this, then you failed in your duty of care for the environment. The Environment Agency does spot checks, and if they do find that non-clinical waste is being unlawfully disposed of, there could be a large fine to pay.